I would like to thank first Ugo for having me here again and let you speak and let you remind you that there is something like eccentric exercise. Actually, it's the only presentation that I've seen that has to do with eccentric exercise. I would just remind you that eccentric exercise is actually what you do when you activate muscle while muscle lengthens, and that eccentric exercise has unique properties which differ it very much from concentric exercise. Eccentric exercise can produce very high torque. It has low metabolic requirements, and eccentric exercise is a challenge for coordination. And I think all these properties can be exploited in particular in rehabilitation and also in exercise training. The high torque is due to the fact that there is no Hill relationship with negative angular velocity. So with positive angular velocity, we all know that torque decreases increasing speed, while with negative work, the torque that is produced first goes up and then stays high, which in fact leads to the very severe consequence that with very high negative loads, you can produce enormous power and you can destroy muscle tissue. Low metabolic requirements, and that's a classical picture by Bigel and Ritchie. We have only about a fourth, that has 4 times less metabolic demand when working eccentrically for the same amount of negative power produced. With regard to coordination, the peripheral situation is such that we only need about half, or we see half the EMG activity in eccentric work at the same torque than at when we work concentrically. This amounts to the fact that it is twice as difficult to coordinate eccentric than concentric work. We also know a little bit, but very little, about the central nervous system. We have to activate larger areas of the central nervous system, and we need more time for preparation of eccentric work, which may be the factor why coordination becomes difficult. When we are sitting on a normal concentric ergometer, it is easy to go to 120, 140, 150 RPM. This is totally impossible. You cannot exceed 60, 70, or 80 RPMs when you work eccentrically, simply because you're not able to coordinate these rapid movements anymore. So let's go to eccentric training. There are essentially 3 eccentric training modalities. You can do drop jumps. I wouldn't really recommend that except if you're specifically trained for this kind of explosive work. You can work eccentrically with eccentric overload. That means a pointer is helping you lift the weight, and then you, in the eccentric phase of your muscle work, you take a larger load that then you can actually lift. There are also devices that allow you to do this kind of eccentric overload training in the fitness studio. Interestingly, the total load that you would do in a single session like that is 4 to 6 tons of weight moved. What I would like to talk about is moderate load eccentric exercise, that is having an electrically driven ergometer that you resist with your legs and that you work against it. We usually do moderate load eccentric training in 4 bouts of 5 minutes, and we use 50 to 300 weeks, 2 to 3 times per week, which then accrues between 6 and 36 tons per single session. As you have seen, this is not recommended. This can be done, but also generally shown that it is more effective than work, just concentric work, and that is what I want to talk about. Moderate load eccentric training. There are basically 2 commercially available technical implementation. One is a cyclist ergometer, where you resist either on an upright cycle or on a recumbent cycle. You resist the motion of the pedals that are driven by an electrical motor, which is controlled by a computer, and that you can use. You can change power, you can change RPM, so it is completely controlled. It's also safe to do it. Or there is another more expensive, an approved version, which is allowed to use in a hospital setting. This is more or less used for training studies in a hospital setting. You can use the Eccentric, and you would then use 2 pedals that work against you, and again you have a computer that controls it. You may ask why we use technical implementation with eccentric exercise training, and the main reason is that we want to be able to reproduce the dosage. It's you have to have a technical implementation. If you walk downhill, you cannot control the dosage. Also, it's all eccentric. And the reason why you need to have a reproducible dosage is that there is a lack of load perception. You don't actually feel how hard you work, and that's completely different from concentric exercise. In concentric exercise, you immediately feel the load, which is not the case when you work eccentrically. So that is necessary then to prevent delayed onset muscle soreness and muscle damage, because you can easily work at loads, eccentrical loads, for 10 minutes, 15 minutes that you don't feel that they are too strong, and you end up with enormous muscle soreness the next day. So if you don't want to have that, you can ramp up the exercise. You can begin with very, very low loads, so there is no risk of muscle damage. You can ramp up the exercise intensity quickly, but I think an important part of why we need these ergometers is that we want to prevent muscle damage while using eccentric exercise in a controlled manner. The proof of principle study has been done quite a while ago, and you can see 2 things here. We had one group that worked concentrically, and one group that worked eccentrically, and the reason was that they worked at the same oxygen consumption. So with the same oxygen consumption that you can produce 130 watts, you can resist 480 watts. So there is again this 4-fold difference in metabolic cost of eccentric work. And you can see if you ramp it up, as we have done it here in this study, the bars down here, this is delayed onset muscle soreness. You practically have no muscle soreness, leg pain on a visual analog scale is barely perceptible at the beginning, and then even at these very high loads doesn't exist at all. So a 4-fold difference in mechanical load between eccentric and concentric at the same metabolic power that we have here. and we could demonstrate in this early study that the strength increased on the eccentric side, while it didn't increase on with the concentric subjects, as you would expect with a very low load. And we could also demonstrate that the people that worked in eccentric mode had an increase in muscle cross-sectional area measured in terms of muscle biopsies in fiber cross-sectional area. So we can use eccentric exercise in a controlled manner, increasing the muscle load and getting a result which resembles a result in strength training. The safety was also considered to be an issue because, of course, a clear patient population that could profit from eccentric work are patients that have central limitation, such as in heart insufficiency and COPD. And so we had a group of patients, a post-infarct patient with coronary disease. And we also worked them similarly as I've shown before. We had them work at the same relative heart rates that you see here, the bars. And you can see again that the concentric patients worked at approximately 100 watts, while the eccentric patients worked at 350 watts. In this study, as you can see here with this patient, we monitored pulmonary artery pressure and pulmonary capillary pressure under load. And you can see that the pulmonary artery pressure, blue is concentric, red is eccentric work, is not significantly different over the whole period of exercise of 20 minutes here. And therefore, I think we can consider eccentric exercise to be safe, at least with regard to the central pulmonary circulation. The added benefit of eccentric exercise in this study was that there was no change in maximal strength in the concentric group, which we wouldn't expect because of the low power that is used in these rehabilitation exercises. But with the same loading of the cardiovascular system with the same heart rate, we could see that the people who worked eccentrically gained muscle strength significantly after the intervention period. In sarcopenia, of course, this is, as we have seen now in very many of these discussions, is related in part to the loss of muscle mass, which then leads to a loss of performance capacity. And we have done a study using a group, 3 groups of octogenaires, people that were around 80 years old, 1 group that did cognitive exercise, 1 group that did classical resistance exercise, and 1 group that used our eccentric ergometer over a period of 12 weeks, 2 times 45 minutes per week with a pre and a post-test sequence. And you can see that as we would expect, no change in maximal strength with the cognitive population, a small change, not significant for the classical resistance exercise group, and significant change for the group who used eccentric exercise. The thigh composition was measured with DEXA, an increase in muscle mass for the concentric and the eccentric group, no change in the control group, but an interesting feature that we saw in quite a number of studies, is that eccentric exercise leads to a decrease in fat content, here measured as thigh fat content, but also significant, we saw a decrease in overall body fat content with DEXA. Eccentric coordination can be measured as the area under this curve, which follows the trace of the pressure you apply to the pedal. This is uncoordinated, this is coordinated. It's difficult to coordinate these eccentric contractions, but people—
4 minutes left.
People get very good at coordinating this, and this was this eccentric coordination gain that we saw with the group that did the eccentric work was not unexpected, but what was unexpected is that this gain in coordination remained. So even when we measured these groups after a year, they still had, the eccentric coordination group still had a better coordination, whereas it didn't change in the control and the concentric group. When we looked at the molecular mechanisms, we could see that molecular markers for muscle remodeling, repair and remodeling were increased. These are mostly related to changes in the interstitial tissue, but unexpectedly we saw that molecular markers for metabolism and mitochondria were decreased, and we also saw a slight decrease in mitochondrial content, which was significant after eccentric exercise, which is of course not really what you would expect. We have also used it in skiers, in professional skiers. You see here one of our top skiers who have participated in these studies have used an eccentric ergometer also at significantly higher loads, essentially even over 1000 watts. And as you know, these people often suffer from anterior cruciate ligament ruptures because of the falls. And in the rehabilitation of these, the group of Paul Ostaya has shown that as compared to normal, in quote, rehabilitation, eccentric exercise allows to gain, these are the black bars, this is the involved side, shows that there is a larger regain in muscle mass if eccentric exercise is included early on in the rehabilitation of anterior cruciate ligament reconstructions. And we have used this training modality quite a lot because it can be used at relatively low loads and still has an effect on muscle mass. So the summary is eccentric exercise can you use in cardiovascular disease to load muscles. It has been used in COPD. I haven't shown the data, but there is data in the literature that this can be used in this context. We have used it in sarcopenia, could show that it increases muscle mass and decreases fat content. And we have used it extensively in knee rehabilitation. When we do moderate load eccentric exercise 2 to 3 times per week, 20 minutes in bouts of 4 to 5 minutes, 50 to 200 watts, we have exercise with a low metabolic requirement for high mechanical loads. It's a strength type training, but with very low joint loads, which increases muscle strength and muscle cross-sectional areas. It decreases also fat content in a local and systemic way, and it increases eccentric coordination, which may be of advantage in old age. But, and that's the but, is it decreases oxidative capacity in trained muscles. thank you very much for your attention.
Thank you, Professor Hoppeler, for this very nice talk. And the paper is open for questions.
Well, if I may,
yes, please.
Just a comment. First of all, it's a very nice and eccentric exercise. Is definitely something to be studied, especially nowadays when we try to find the best form of exercise. I have lost a part of the talk, so maybe I'm missing something, but I wonder if you know which would be the mediator from the literature or by looking at them yourself that could account for some differential response, the different exercise types of exercise. For instance, are different myokines secreted or found in the circulation in the different conditions, these kind of things?
I think there is actually not a lot of basic work done with eccentric exercise, and I think it would be interesting, Ugo, next year to actually have also a session on eccentric exercise and try to bring in people that actually do work with molecular techniques on eccentric exercise. You know, it is, one point is that we even don't know how eccentric exercise works. We do not know how physiologically, what the physiological mechanisms are that produce tension during eccentric works. It's suspected to be related to titin, but it's not even sure. It's not uncontested.
Okay, Feliciano, yes.
Yeah, very quickly.
Yes,
I mean, my question was for the speaker, but also for the audience. So, what are the molecular mechanism underlines this response? The only thing I know myself is that on the surface membrane of muscle fibers, there may be calcium channels which are stretch activated, which could mediate a response of muscle mediated by entry of extracellular calcium, which activates the signals for protein transduction. And but I don't know if anybody else knows anything about this. Maybe Carlo can add something. But studying the molecular mechanism underlying this response of muscle to eccentric exercise would be very important.
Yeah. There is a question also from Professor Narici. Please, Marco.
Yes, thank you. A question and a comment. Well, in relation to the molecular pathways activated by eccentric and concentric training, it has been shown that the two types of training activate different MAP kinases. And so these could mediate these different types of hypertrophy and the muscular responses. I also wanted to say that there is also an additional benefit of training at lower intensity, as shown by Professor Hoppeler, is that elderly muscle attains peak protein synthesis at 60% of the 1 repetition maximum, whereas younger muscle attains the same at 75% of the maximum. So using lower loads in older people is optimal for optimizing their protein synthesis.
Thank you.
Welcome.
Professor Reggiani, do you want to add some comments?
If I can add a comment to this very interesting presentation, is that the main difference, I think, is just the tension applied on the muscle. In the muscle, there are some, not completely understood, anyway, molecular sensor of load of tension, and what we can obtain with eccentric exercise, as Professor Hoppeler has very clearly demonstrated, that with the same amount of oxygen consumption, with the same heart rate, in comparable condition for the whole body, we can produce much more tension on the muscle. And this much more tension is means more stimulus on the mechanism producing hypertrophy. So I think that this is the main difference, no? More tension. Now, what is the mediation of the tension? Very likely is the same, I would say. Of course, more tension on the same sensor will produce more response. No? The sensor can be the integrin. We have been discussing yesterday and today about this lateral transmission of forces, or integrin, and connected with integrin, for example, focal adhesion kinases, or sensor placed in the Z line, related in this case maybe with titin kinase, or other proteins of the Z line. But I would say that I would stress the point that is tension. I don't know if Professor Hoppeler agrees on this, but the difference in tension is the main point.
I entirely agree, and that is, I think, why we wanted to use it in situation where simply because of cardiovascular limitation, you couldn't produce enough tension to load the muscle. So if you cannot do it because you use too much oxygen and you cannot supply it, use eccentric exercise. You can still stimulate the muscle, you can get muscle hypertrophy without actually overloading the rest of the system. That was the initial motivation to do that work.
Good. I have just, yeah, Ugo, do you want to ask something?
Of course, the one of the session next year will be on your dream, Hans.
Okay.
But I have a strong suggestion. To motivate molecular myologists, there is only one factor: money.
Yeah, I know. And you know why? And people don't do the eccentric exercise because everybody says it damages the muscle. It's only when you do it wrong. So, you know, that's the snag of eccentric exercise, at
But
least as
we will strong support you as strong as we are motivated.
Okay. I look for the best of molecular scientists next year, okay?
I have just a quick comment, the very last one, because you said that the moderate load eccentric exercise decreased the fat content within the muscle. And this is very important, I think, because it can improve myosteatosis, right?
Con load molto basso.
Yeah, but I think that in sarcopenic obesity or in sarcopenic subjects where you have an increase in the fat content, this type of exercise can be effective. And therefore, I think that this is a very interesting finding.